You know, AI and medicine, it's not science fiction anymore. According to the absolute latest research, it's making the jump from the lab straight into the clinic. And it's looking like it's going to change how doctors do their jobs. But that brings up a really, really important question.
I mean, this is the question, isn't it? It's the big one. It's exciting for sure, but it's also a little bit scary. And it's exactly what the top researchers in the world are trying to figure out right now as they build these incredibly powerful new tools.
So let's get one thing straight. The most promising way forward isn't about AI replacing your doctor. Not at all. Instead, think of it like this. AI is the new teammate, a powerful partner right there in the room with the medical team.
Okay, so what can this new teammate actually do? Let's take a look at some of the most fascinating new tools that are coming out of the research right now. This is where things get really, really cool, and you can see the sheer potential of what we're talking about.
Think about this for a second. We're talking about predicting a seizure, but not, minutes before it happens. There's a new model called Seizure Former that can analyze data from brain implants and actually forecast the risk of a seizure up to 2 weeks in advance. This could literally change the game for proactive treatment, completely transforming how we manage things like drug-resistant epilepsy.
All right, so it's one thing for an AI to just circle a spot on a scan and say, hey, problem here. It's a whole other ballgame for it to explain why it thinks that's a problem. A project called 3D Reason Key is actually training AI to do just that, to look at a 3D MRI and then spell out the same reasoning steps a human radiologist would. This is all about building trust right into the system itself.
We've all been there, right? You leave the emergency room with that stack of discharge papers, and it's just overwhelming. Well, the ED Explain system is designed to fix that. It takes all that dense text and turns it into a personalized video with a virtual provider explaining everything nice and clearly. And get this, in early tests, actual emergency room doctors rated the AI videos as being more complete and easier for patients to understand.
And here's a headline that really makes you stop and think. There was a massive test, we're talking almost 700,000 questions about chest x-rays, and a model called MedGemma actually scored higher than human radiology residents on certain tasks. Now, that doesn't mean it's a better radiologist overall, but it just shows you the incredible progress being made in some of these core skills. So when you just look at this list, you can really see how widespread this is. We're talking about everything from predicting seizures in neurology and reasoning through MRIs, to making patient care better with video summaries, and even interpreting x-rays. These tools are pushing the limits in all kinds of different medical fields. But, and trust me, this is a huge but, there's a massive gap between what an AI can pull off in a perfect, controlled lab environment and what it can do in the messy, chaotic, unpredictable real world of a hospital. And that brings us to some pretty major challenges. Researchers actually have a name for this gap. They call it the intention-execution disconnect. And what it means is that an AI might know all the right medical facts. I mean, it can recite the textbook perfectly, but it just completely falls apart when it tries to apply that knowledge to a real complex patient. It's the ultimate example of having all the book smarts in the world, but zero street smarts. And you can see that disconnect right here, plain as day. In the lab, where you've got normal cases and nice clean data, the AI is a superstar. But in the clinic, it has a hard time with weird or abnormal results. It gets totally lost trying to read a doctor's complicated notes, and it just doesn't have that deep, nuanced expertise that a human gets from years of experience. So how big is that disconnect really? Well, get ready for this number, because it's staggering. When some of the top AI models were tested in a way that truly mimics a real clinical workflow for reading chest x-rays, they only produced a correct, useful report between 5 and 10% of the time. Let me say that again, 5 to 10%. That is a massive canyon between the hype and the reality. And look, this isn't just a one-off problem. The research is showing this across the board. Sometimes these incredibly complex AIs get beaten by much simpler models. They have a hard time figuring out what's actually important in a patient's history, and they fail at really complex stuff like spotting an adverse drug reaction. That gap in deep, human-like expertise is a fundamental challenge that keeps popping up. So, what's the solution? We just give up? Absolutely not. It's about getting smarter. Researchers are now laser-focused on building the specific tools and methods needed to bridge that gap between the AI and the human doctor to make them better teammates. One of the most important safety features they're working on is something called abstention. It sounds technical, but it's a really simple, profound idea. You program humility right into the AI. You teach the model to know what it doesn't know. So if a scan is weird or doesn't fit the patterns it recognizes, instead of taking a wild guess, it just stops and says, hey, a human needs to look at this. Researchers are also completely overhauling how they even test these AIs. They're moving beyond simple accuracy scores. They're building whole new evaluation frameworks. This means creating gigantic, diverse data sets with guidance from doctors, designing tests that focus on real clinical skills, and, this is the most important part, testing these models in settings that actually feel like a real hospital.
And that's really the key idea here. The way we get to a truly useful medical AI isn't just about bigger algorithms or more data. It's about developing smarter, more honest, and way more realistic ways to measure what these systems can, and, maybe more importantly, what they can't actually do in the real world.
So when you put it all together, the incredible, mind-blowing promise on one hand, and the pretty sobering reality check on the other, you end up with a pretty clear vision for the future. It's not about replacement. It's all about a powerful new kind of collaboration.
Probably the best way to think about it is like this. An AI is like a brilliant but very, very new medical resident. It's memorized every single textbook ever written. It has this just encyclopedic knowledge, but it doesn't have real-world judgment or common sense or that deep understanding that only a seasoned doctor has. It needs supervision.
And that leads us right to this final thought, and this comes straight from the research papers themselves. The goal is to design systems that deliberately complement what humans can do, letting the AI handle the huge amounts of data and spot subtle patterns while leaving the final judgment, the empathy, and the real-world understanding in human hands.
Which leaves us with one last big question to think about. In a world where an AI can process all the data and knows all the facts, what then becomes the most uniquely human and the most important part of being a doctor?